policing the police every single day, and doing what the Charlotte County Sun newspaper and local TV stations won't do every single day.
April 14, 2020. Sheriff Rick Wells. Manatee County Sheriff's Office. 600 Highway 301 Boulevard West. Bradenton, Florida 34205. Re. COVID-19 threat necessitates immediate reduction in jail population and other precautions. Dear Sheriff Wells, during this rapidly growing public health crisis, public officials must take immediate actionable steps to mitigate the spread of the COVID-19 pandemic and protect public safety and public health, including those on the front lines of the criminal legal system and those who are in your custody and care. As you know, there is a consensus among public health officials that the COVID-19 pandemic poses an enormous and potentially catastrophic risk to detained individuals. We are writing to urge you to implement the below common sense steps to rapidly address many of these risks and safely reduce the incarcerated population in order to save lives. The below recommendations carefully balance the need for protecting the public's health and public safety. During this pandemic, it is critical to the public health and safety of our community to ensure that people are not unnecessarily entering the criminal legal system in the first place, and that those who do not pose a threat to the public are not needlessly detained in jail, especially those vulnerable to COVID-19. The non-exhaustive list below includes recommended actions based on the CDC recommendations and those of medical experts. The United States Attorney General, William Barr, stating the concern that prison institutions will become petri dishes of COVID-19 infection, recommended federal prisons safely reduce their populations, especially for those most vulnerable to infection. He also urged prosecutors with respect to setting bail to consider the medical risks associated with individuals being remanded into federal custody during the COVID-19 pandemic, cautioning that each time a new person is added to a jail, it presents at least some risk to the personnel who operate that facility and to the people incarcerated therein. 1 https://abcnews.go.com/politics/ag-william-bar-pushes-expansion-home-confinement reduce. Story, ID equals 698165504, https://www.politico.com/news/2020/04/066/William-Barr-attorney-general-coronavirus- 169,232. ACLU letter re, COVID-19 page 2 of 5. 4 counties that contract with Immigration and Customs Enforcement, ICE, to provide bed space in their jails. These agreements pose additional and unnecessary burdens on your ability to protect those on the front lines as well as those in your custody and care. Now more than ever, local officials should follow Monroe County's lead and suspend any contracts with ICE for civil immigration detention bed space to reduce overall exposure risks for people in local facilities, including all those detained as well as officers and staff. Point 2. Additionally, consistent with U.S. Attorney General Barr's statement, noted above, that each time a new person is added to a jail, it presents at least some risk to the personnel who operate that facility and to the people incarcerated therein, sheriffs should consider suspending Warrant Service Officer, WSO, and 287G, agreements that force frontline officers, employees, and current detainees to multiple in-person interactions with individuals for objectives that do not pertain to the enforcement of state criminal laws. Need for immediate action before it's too late. As of today, there are over 17,000 confirmed cases in Florida, and over 370 COVID-19 related deaths. Additionally, as of April 9, the public has been made aware of at least 42 Florida prison workers who have tested positive for COVID-19, over 30 people incarcerated in Florida prisons, at least 5 residents detained in jail pre-trial, and at least 1 individual detained pre-trial has died of COVID-19. To be clear, steps you take, or don't take, today will have grave consequences for Floridians tomorrow. A swift and coordinated response is needed to save lives and protect incarcerated people, staff, and the public from the increasing threats posed by COVID-19. County jails are at great risk for a mass outbreak. Incarcerated individuals cannot isolate. People eat, sleep, work, and spend their days close to one another and share sinks, showers, and phones. Social distancing is impossible. Hand washing is not prevalent, and hand sanitizer is often banned. Limited access to medical care, testing supplies, and personal protective equipment increases the possibility of viral outbreaks. The population churns daily, and thus jails accelerate the spread of COVID-19 into the greater community. People continuously enter, and the vast majority will be released back into the community. Corrections staff, attorneys, and visitors continually come and go. Thus, reducing the incarcerated population can do more than protect the people who live in the jail. It can also reduce the risk of the jail becoming a site of cluster infection, thereby protecting the entire community. Point 3. Furthermore, jails face significant financial burdens from COVID-19. Jail staff are at a high risk of contracting COVID-19 and calling in sick, necessitating both overtime and potentially unsafe inmate guard ratios. The jail will bear the health care and any hospitalization costs to treat ill inmates. 2 https://www.miamiherald.com/news/local/immigration/article 2417839226.html. Amid concerns of COVID-19 pandemic, Monroe County cancels its contract with ICE. 3C Amanda Glinsky, an epicenter of the pandemic will be jails and prisons, if inaction continues. NY Times, March 16, 2020, https://www.newyorktimes.com/2020/03/1/6/opinion/coronavirus-in-jails.html. ACLU letter re, COVID-19 page 3 of 5. Requested actions. The best way to stop the spread of COVID-19 in jails is to decrease the number of people entering the system and to safely reduce the overall jail population. This can be accomplished in the following manner without compromising public safety. Sheriff actions. We urge you to implement the following to prevent the virus from entering our jails and containing it once it is in the jails. First and foremost, every effort should be made to keep the jail sanitized and reduce the number of people in custody to maximize social distance among those incarcerated and mitigate against widespread transmission. 1. Sheriff's deputies should issue notices to appear in lieu of arresting a person for a misdemeanor or ordinance violation. FLAR.CRIMP 3.125b provides this authority. Doing so balances the need for arrest for low-level offenses with the overwhelming public safety concerns presented by coronavirus and limiting the risk of bringing someone who may have the virus into a station and potentially infecting other personnel or first responders, as well as the risk to the individual of being infected by close proximity to others incarcerated. 2. When sheriff deputies do effect a necessary arrest, prior to any contact with other detainees or staff, newly arrested persons should immediately be tested for COVID-19, as approximately 25% of infected individuals are asymptomatic carriers of COVID-19. 4. If an individual tests positive, the individual must receive adequate medical care and should be properly quarantined, separate and apart from other detainees, with access to showers and mental health services, phone calling with family, and communications with counsel, for 14 days, to protect their safety and the safety of all those in the jails. 3. For those currently detained, there must be access to proper testing for anyone displaying known symptoms of COVID-19 in accordance with CDC guidelines. 4 individuals identified as having COVID-19 or having been exposed to COVID-19 must receive adequate medical care and be properly quarantined, with continued access to showers, mental health services, phone calling with family, and communications with counsel. Individuals shall not be placed in cells normally used for disciplinary confinement absent emergency circumstances. If the facility cannot provide adequate medical care, the individual should be transported to a local hospital, wearing an N95 mask. 5 efforts should be made to ensure incarcerated persons and staff are educated about COVID-19's symptoms and ways to reduce its spread. Jails should provide adequate spacing of 6 feet or more between people incarcerated so that social distancing can be accomplished. 4 https://www.newyorktimes.com/2020/03/311/health/coronavirus-transmission.html. ACLU letter re, COVID-19 page 4 of 5. 6. All jail personnel should be routinely screened for temperature prior to entering a facility and tested for the virus as soon as this is possible. 7. When tests are available, publish the numbers of tests conducted and results for those incarcerated and the employees. 8. Keep facilities sanitized and provide, at no cost, adequate soap, hand sanitizer, tissues, and other hygiene supplies. Ensure access to warm water to frequently wash hands. 9. Create a staffing plan for when jail officers are not able to come to work as a result of COVID-19. 10. Jail personnel should make all reasonable efforts to maintain social distance from prisoners and from one another. 11. Continue to keep lines of communication to family, friends, and legal counsel open by making it free and accessible. 12. Suspend or cancel any agreement to house persons transferred to the county jail by ICE. 5. Local officials should suspend any contracts with ICE for civil immigration detention bed space to reduce overall exposure risks for people in local facilities, including both detained people, officers, and staff. Suspend or cancel any warrant service officer, WSO, or 287(g) agreements, as they unnecessarily place those on the front lines and those in our county jails at increased risk of COVID-19 exposure through in-person interactions with multiple individuals for objectives that do not pertain to the enforcement of state criminal laws. State Attorney actions. The state attorney should utilize their immense discretion to limit the number of people who are held in jails or in other confined facilities by significantly reducing their requests for pretrial detention and carceral-based sentences as recommended below. Additionally, no one should be placed in greater risk of exposure to COVID-19 simply because they are too poor to afford bail. Prosecutors should make full use of available diversion programs or alternatives that don't involve confinement and offer non-confinement sentences in plea bargaining. 1. The bail schedule should be revised to permit the immediate release without monetary conditions of those charged with misdemeanors and nonviolent felonies or a technical violation of probation. 2. The state attorney should publicly announce and enact a policy of consenting to the release of any person whose current monetary bail is $10,000 or less on non-monetary conditions or with satisfaction of a monetary bail found to be affordable. 5. https://www.miamiherald.com/news/local/immigration/article 241783926.html. Amid concerns of COVID-19 pandemic, Monroe County cancels its contract with ICE. ACLU letter re, COVID-19 page 5 of 5. 3. Where an accused person is not released pursuant to the revised bond schedule or the state attorney's policy, the state attorney shall ensure either, a. the conditions of release are non-monetary or affordable, or, b. the state has established a need to detain the accused beyond a reasonable doubt and notwithstanding the COVID-19 pandemic. Prosecutors should avoid cash bail requests and request release on non-monetary conditions in all but the very few cases. 4. With a special focus on populations who the CDC has identified as particularly vulnerable, prosecutors should also institute a review and release protocol in cases in which bail was already sought and the person is currently detained. 5. The state attorney should seek to identify and quickly resolve criminal cases amenable to a time-served sentence considering the unprecedented COVID-19 pandemic. 6. When seeking a plea or requesting a sentence, prosecutors should consider incarceration into cramped and often unhygienic facilities as a last resort, and refrain from seeking community-based sentences, such as curfews, geographic restrictions, or electronic monitoring, that limit a person's ability to seek medical help or care for a loved one who has COVID-19. 7. Finally, prosecutors should dismiss cases involving minor offenses, thereby limiting the amount of time a person must spend in court. We are urging you to immediately implement the above common sense steps to prevent the spread of COVID-19 in our community and protect the most vulnerable populations during this pandemic. Thank you for your prompt attention to the above, and please do not hesitate to contact us if you have any questions or would like any additional information. Sincerely, ACLU of Sarasota/Manatee/DeSoto Counties. John E. Lemoli, ESQ, Acting President. Larry Ager, ESQ, Vice President. Moira Desir, Secretary. Michael Barfield, Director. Alex Birkin, ESQ, Director. Aaron Getty, ESQ, Director. Susan Nyland, JD, Director. Janetta Casio, Director. Grissom Walker, ESQ, Director.
Hey Charlotte County, this is Charlotte County Cop Watch. I am using any video here with under fair use if you have criticism, reporting, teaching, etc. And please donate. I do not make money from YouTube, and there are different ways to donate in the video links. Thanks.